Hello, we are the Biomedical Science Students Association at McNeil High School, and today we'll be discussing HIV and AIDS. First, what is HIV? HIV, otherwise known as the human immunodeficiency virus, is a virus that targets and weakens the immune system by destroying a specific type of white blood cell, thus making people more vulnerable to other infections and diseases. It is a common misconception that HIV and AIDS are interchangeable terms. In fact, AIDS actually refers to the latest stage of illness caused by HIV, not HIV as a whole. AIDS stands for Acquired Immunodeficiency Syndrome, referring to the immune system's inability to fight off infections and diseases as a result of having HIV for a prolonged amount of time, or of leaving HIV untreated for 8 to 10 years. A person with AIDS will more likely develop opportunistic infections or cancers, which are diseases that wouldn't usually cause illness in a person with a healthy immune system. Anyone, regardless of sexual orientation, ethnicity, race, gender, or age, can be impacted by HIV and AIDS. Partaking in risky or improper sexual activities heightens the risk of contracting HIV exponentially. This disease can also be transmitted to the child of a mother with HIV who recently gave birth or is breastfeeding. Since HIV is transmitted through bodily fluids, which can be present in sexual activity, practicing safe sex using methods like condoms, or further partaking in abstinence from sex can prevent HIV transmission from vaginal sex, anal sex, and semen. As for the transmission risk through blood, sharing drug equipment, especially unclean needles, is very dangerous and should always be avoided. Contact with an infected person's sores or wounds through mouth or skin or with infected sharp objects should also be avoided. Although unlikely to cause infection with the 1% transmission risk, mothers with HIV should abstain from breastfeeding and contact their doctors for other solutions, as breast milk carries the possibility of infecting their child. Furthermore, for people with a high risk of HIV, taking a PrEP, pre-exposure prophylaxis prescription, can significantly lower the chances of an HIV infection through drug usage. Some symptoms of HIV are similar to the flu, which includes rash, chills, fevers, muscle aches, fatigue, and more. These symptoms can last anywhere between a couple days to a couple weeks. However, not everyone experiences symptoms. It is estimated that 1 in 7 living with HIV are unaware of their infection. The only way to confirm HIV or AIDS is to be tested by a medical professional.
HIV can be diagnosed through tests examining blood or saliva. Some tests include antigen tests, antibody tests, or nucleic acid tests. Antigen tests can be conducted by drawing blood from the vein. Antigen tests look for the amount of antigens that are on the HIV virus in the bloodstream. Antibody tests can be conducted by drawing blood from the vein as well. Some self-tests that can be taken at home are antibody tests. They test for the amount of antibodies that the body produces in reaction to the presence of the HIV virus. Nucleic acid tests are conducted by drawing blood from the vein as well, and measures the amount of viruses in the blood. After a patient is diagnosed with HIV, their doctor will conduct other tests to determine the stage of the disease. Based on these tests, the doctor can work with the patient to guide them through treatment options and any possible lifestyle changes. What are some lifestyle changes someone with HIV may take on? For starters, maintaining a healthy diet and exercise can help boost the compromised immune system. Taking medications is also a key aspect of living with HIV. Patients often have to follow treatment plans and take various antiretroviral therapy to reduce the amount of viruses in the body. Monitoring HIV patients' health is critical, and if not taken care of properly, their immune system can weaken and put them at a risk of opportunistic illnesses. Patients also have to be careful about eating foods that are contaminated with foodborne illnesses, as they can be life-threatening for those infected with HIV. Some people with HIV or AIDS face discrimination and prejudice, which stems from fear, myths, and inadequate information. Oftentimes, reaching out to other HIV patients for solace and forming a support group can be beneficial while battling HIV. Although there is no cure to eliminate HIV yet, there are many treatments that can be used to control the development of HIV so that patients can continue to live their normal lives. To help those with HIV or AIDS, we can learn more on our own by keeping up with modern research on HIV or AIDS through professional sources such as the CDC. Feel free to donate to the websites linked in our description to help scientists with research and finding a cure for HIV or AIDS. Thanks for watching! Click the like button if you liked the video and subscribe to our channel to learn more about other illnesses and diseases. Turn on the notifications button to be notified when we post a video.